So thank you for showing up on a rainy Saturday evening here. It's a great turnout. My name is Joe Balogh. I'm a director of marketing for Bracco, and we're bringing this product that you're about to see to market. And we hope to be able to show you some very interesting cases and some very interesting technology and true stereoscopic three-dimensional imaging. So let us get started. So this is basically the practical application of virtual reality to neurosurgical planning. And what you see here is a product. This guy here is called the Dextroscope, and it's produced by a company that Bracco has acquired called Volume Interactions out of Singapore. And a number of the people who founded the company and who are the head of the company of Volume Interactions are here to answer your questions if you have any. But basically, it's a console like this that has a monitor, and then there's another monitor up here. And you'll see that there is a mirror here that reflects what's on the monitor. This monitor to the right is mainly a control monitor, so you do your DICOM downloading and uploading of information and your image preparation, for instance. And you actually work in this space right here. And so you put on these active 3D shutter glasses, and you sit at this console, and you reach inside, which I'll show you in a minute, so that you're actually reaching inside to the space and manipulating the three-dimensional virtual objects. So you're looking at this mirror right here, and then you are able to see multimodality image fusion and three-dimensional stereoscopic images. So we have to start off with the question of what is virtual reality. And there's really three essential elements to virtual reality as we know it today. One is immersion, navigation, and interactivity. And in immersion, it's giving you the illusion of being in the space. It gives you a sense of presence in the virtual space. And our system, through the use of the glasses and the interactivity with your hands, your two hands, give you the illusion, a very strong illusion, of being able to actually almost feel the virtual object, and you feel like you're present in the virtual space. The ability to navigate around that or within that virtual space, to move around, is also very important to virtual reality. And with the left hand using a controller, which you'll see in a minute, you're able to, rather than move around the object, you're able to move the object around in any way you want to be able to see it from any angle. So that gives you that ability as well. And then the third is interaction, the ability to manipulate the object. And with your right hand, utilizing a multifunction stylus, you're able to operate on the virtual object and also operate a virtual control panel. So in the past, virtual reality was this. It was a head-mounted display looking at a monitor, maybe some motion trackers. So as you moved your head, it would follow you. Instrumented or digital gloves or some sort of haptic feedback device to make you feel like you're in the virtual environment. You're also limited today by your ability to go into the environment. So even if you look at a 3D object on a screen, on a computer screen today, you're still limited by the two-dimensional presentation of that 3D object. So that screen becomes a barrier. Also, the keyboard and the mouse become barriers to your use of being able to manipulate the object. So what we have today is, we're calling it the practical application of virtual reality to neurosurgery. And so this is Dr. Cockrow, who's sitting right there, sitting at the console and reaching into the space wearing the glasses. It's a very comfortable environment to work in. And what will happen is you're able to visualize the image in stereoscopic 3D and be able to get images like this that you'll see. And then you're able to get real-time volumetric and surface rendering. In a normal flow of things, you have a patient and you do a CT or MR, and you'll see a case tonight from Dr. Balogh where they just got an MR, normal MRI study that you would get on any particular patient, but you could also get a CT, a CTA, or an MRA, and bring all those different data sets together load them up into your PACS DICOM network in your hospital, and then here's where the Dextroscope would be inserted into the flow of things, where you would take this data and be able to manipulate it and do your surgical planning, and then you have your created an operational plan. This product gives you a high level of interactivity. Here you see someone reaching into the virtual space and with the left hand be able to grab the object and with the right hand operate on it. And again, you have to wear these active 3D shutter glasses. But tonight you will not be wearing these active 3D shutter glasses. You'll be wearing polarized passive glasses because we have a left eye and a right eye projector there for you. So this is passive, but while you're in the environment, you're wearing active glasses. Your left hand holds this 6-dimensional controller, 6 degrees of freedom, and it's being tracked in space by a 3D tracking device, so it knows exactly where you are in space at any time in the orientation. And the right hand holds this stylus that you can operate all of the various controls with. And when you touch down, and you'll see when Dr. Sarah operates the Dextro Beam, which is a projection device, when you touch down on the base, you get this virtual keyboard or a control panel, and with the stylus, you're able to touch buttons, virtual buttons and sliders, and manipulate the image any way you want to. You can set your window and your threshold. You can set the color lookup table. You can choose which volumes to display and which volumes to fuse together. And then when you lift up, the panel goes away and you see this. You're able to cut and crop the image any way you want to. Next. You also have the ability to do multi-modality image co-registration. So as I said before, you can take a CT or an MRA or an MRI and register all those volumes together. Next. So you also have what we call a virtual toolbox. You have registration tools which allow you to register different volumes together precisely, visualization tools which allow you to set the way the object looks in 3D, segmentation tools so you can separate out vessels or tumors or pathology, and reporting tools so that you could make digital recordings of your activities, your interactions, or you can take snapshots and include them into reports as well. So all of the cases that you will see tonight were done on the Dextroscope, so sitting at the console, interacting in this virtual environment. But what you're going to see tonight for a large group presentation is it being done with this Dextro Beam, which is sitting right here, and Dr. Sarah will be operating it live. And we will have the presenters, the physicians, narrating exactly what they're doing, and some of them will actually do their own presentations. We have 2 projectors here that will give you a left eye and right eye presentation, and you have the polarized glasses there, which you'll be able to put on and see a 3D effect. So this is not a normal screen, it's a silver screen which maintains the polarization, but when you put on your glasses, you'll be able to see it. So finally, coming to the agenda, I'm basically done with introducing you to the concept of this virtual reality 3D imaging. I'm going to introduce Dr. Sarah, who is the President and Chief Technology Officer of Volume Interactions. He's also one of the founders of the company and had a lot to do with creating the software. And he's going to show you some of the things that the system can do. And then Dr. Cockrow, who is a VP and Medical Affairs Director at Volume Interactions, will show you a case presentation of his own. He's a neurosurgeon practicing in Singapore. And then we have 3 presentations. Dr. Shoulder from UMDNJ in Newark will show you a facial nerve schwannoma case that they recently did. And Dr. Baltuck will be an intraventricular tumor. And then Dr. Conesa from Barcelona will show you a brainstem cavernoma. So just a little bit of, okay, we can move on. So let me turn it over to Dr. Sarah and take it from here. If you have any questions, we'll have a Q&A session at the end, and we'll have our presenters sit up here, then you can ask them whatever you need.